We all know that diet and exercise can do a lot to change the way you look and feel, but what about some high-tech options? Dr. Bill Johnson of Innovations Medical has a combination that can help you get that shape that you want. Dr. Bill, how are you?
Good evening.
Good evening. Now, in the morning, we've talked about this combination before. It's really, really cool, this innovation. What procedures are you combining?
Yeah, we like to call it our new you combination, and it's one that really makes sense because we're taking two procedures that are based on liposuction that we do in the office under local anesthesia. We're combining natural breast augmentation to an awake tummy tuck that we actually do with the patient awake under local.
This is cool. Let's talk about the first part of this equation, the natural breast augmentation. How does this work?
Well, natural breast augmentation is really fun, and it's one of the fastest growing cosmetic procedures in the United States right now, because what we do is we take the fat that we've removed with liposuction, we do a little processing to it, and then we re-inject it into the breast. So you get the body trimming that comes from having liposuction done, and then you get a very natural looking and feeling breast, because the breast is mostly fat.
Yeah.
So we're just replacing what's been lost after weight loss or after pregnancy, or actually we can augment what you didn't have.
Yeah, well, you know, this is a dream for a girl. This is like a girl's dream come true, like taking fat out of places that we don't want it and putting it somewhere else.
I think that's why it's growing so fast.
I'm sure. Okay, and this is all natural too. So let's talk about the other half of it, which is the tummy tuck. What's involved with that?
Once we've done the liposuction on the abdomen, we can then take and remove that extra skin. That's such a problem for women that have gained weight, or a lot of women get it just after pregnancy.
Sure.
And so we flatten everything out and shape it with the liposuction, and then we can actually remove that flap, and as you can see on the animation, we can remove all of that extra skin, cut it away. We then sew it up with a special type of suture that doesn't require any real maintenance. You don't have to go back in and get stitches out. We put a glue over the wound so there's no dressing changes or things to do. You have drains in for a couple of days, and once the drains come out, you're basically back to normal activity.
Okay, so what are we talking for downtime?
We're talking usually about 3 to 5 days, and most of our patients are going back to work in less than a week.
Wow, and that's also because of the fact that this is a natural augmentation, and also because of the fact that you're awake during this tummy tuck.
You're awake during it.
You're not totally knocked out like you would be for a normal procedure.
Right,
like this.
You're not knocked out. We don't work on the muscle.
Yeah.
We just take away that excess skin. And doing it under local anesthesia has a real low risk factor. It allows us to save on the cost. It ends up being a lot less expensive when you don't have a surgery center or a hospital that also has to be paid as part of the procedure.
This news gets better and better as the segment goes on. Okay, you do have deals for our viewers tonight. What do you have?
Yeah, on the special, we're taking $1,000 off between now and the end of the month. We're taking $1,000 off of the combination of the natural breast augmentation and the awake tummy tuck.
Okay, so we can start off the new year with our new figure. Dr. Bill Johnson, great stuff and very innovative. So thank you so much for sharing with us today. And if you want more information, you can log on to innovationsmedical.com or give Dr. Bill a call. It's 972-331-8844 for a consultation. And if you have a question about Dr. Bill Johnson, just drop him an email at questions@innovationsmedical.com.